I had many times as CMS administrator where people would tell me that they would do stuff if only I would give them a better financial incentive to do it. And I told them, the right thing to do. I'd love to reward you for it and figure out how to, but I will tell you, my changing the financial incentive is not going to be what makes you change the way you care for your population. You either have that already or I'm not going to give it to you.
We're calling this the Medicaid Transformation Project, and the thing that feels important and seminal about this work to us is that we're seeing the coalescence of some really unique dynamics in healthcare. Every day, we're learning more and more about new care models and technology-enabled care models, and we're seeing an evidence base really begin to swell that's telling us what works well with specific populations, how we can have a disproportionate impact on vulnerable populations, and then ultimately what interventions work in what care settings, under what conditions, under what time.
From my perspective, we embrace it because it's definitely part of our heritage and our culture. That said, we also have to get a return on the investment in this because no margin, no mission.
When you think about structure, I could actually sit there and say, gee, I feel so bad for ourselves. We're one of 19 states that did not do the exchange. I've got ACA reduction. I've got reduction from Medicaid. I'm just going to wallow in my sorrow and wait for this prince to come up and save me. Well, the bottom line is no one's going to come. And you're going to have to be self-aware, self-directed, and take on this project the way you really need to. And if we believe that healthcare is local, then our responsibility to the region is also local.
The power here is trying to take the power of what you're doing and leveraging that with what currently is 15, 18 different health systems around the country, sharing their experiences. So if people can learn from you how you set up the population health management for this, and people will learn about how you do the collaborative work together so that it starts to get a little faster, I think that we will really make some headway.
We don't pursue technology for the sake of technology. We pursue technology to solve problems. In this context, we're thinking about transcending that and looking at specific care models and care models that can get further, faster, and better vis-a-vis technology.
So we are an industry rich in data, but nobody really transfers data into information. So I'd like to ask any one of you, when you have the data set in front of you, do you have descriptive data analytics associated with that? Do you have diagnostics does it tell you why? Do you have predictive analytics that tells you what could happen? And then do you have prescriptive analytics that tells you what to do? Well, the problem is we don't do any of those. And I think if we could just start in just setting a very simple understanding of the analytics, then you can begin to start anywhere, because what you're going to find is it's so endemic, it's sad.
If you can figure out how to handle what is typically known as one of the toughest populations, the rest of it's going to be easy. And that will all trickle up, which eventually was going to lower the cost of care, and we're going to have much better outcomes. Don't wait for your neighbor to do it, just go do it and then lead the process. And when it's a success, everybody will join along.
What I learned at CMS traveling around, I mean, we made health equity a cabinet office at CMS when I was there. And one of the things we learned was that unless people said we're not just going to measure cost, quality, and outcomes, access points, we're going to measure the difference between the top and the bottom, and we're going to bring the bottom up to the top. And unless people had an attitude of no excuses, because as soon as you say, well, these patients are harder to take care of, you're essentially telling yourself it's okay to have a 30% worse outcome.
Yeah. Right.
But if you say, you know what, I may have to invest differently, I may need to put more resources here, but I'm going to measure it and make it visible and it's important, then you actually can close that gap.